I'm Paul Hodges from the University of Queensland. I've been investigating back pain for more than 20 years. Deciding what treatment you need or what treatment might work for you is really difficult. And that's because there's no crystal clear guidelines for how you choose what's going to work for an individual person. And one of the things that hopefully this website does is gives you information that you can use to help make the decision that might suit you. And it's really about what preferences you have, so what kind of interventions you want to try, but also about the advice from your healthcare provider. Maybe that's a doctor or a physiotherapist who can help guide you through what they think might be the most appropriate for you. But it's very difficult to give general advice because everyone with back pain is different.
In terms of managing low back pain, I think the more resources you get, the better. Build up your strategies. I think an important part is self-management. You taking back control of driving where your treatment's going or driving the strategies. And, some strategies may not work at a certain time, but try and build up your toolkit with as many different strategies as you can. Looking at pacing, looking at re-engaging in life based on what you value, because it's important to live a life that's meaningful to you despite having this pain. Getting those endorphins going, which will help you build up strategies to manage pain and get those hormones going that help you manage pain.
If you stop moving, you become deconditioned. The pain at the moment will have some sort of influence on your muscle system. And in fact, if you want to keep your back as healthy as possible, you want to be using those muscles and making them work well. So by just stopping doing everything, you're actually deconditioning yourself and maybe actually contributing to the next recurrence of pain. So it is better to work out strategies of how to do things that limits the stress on your back, that means that you can do the activity easily, and then that you can just progress. Don't let back pain stop you doing anything you want to do. What you have got to do is maybe do it more intelligently than you've done it before.
Let me talk about the evidence and the effectiveness of treatments for low back pain. I think in the short-term instance, one of the helpful things is to just keep moving, I suppose, would come across fairly clearly in the scientific literature, and that can be aided by some interventions. Perhaps some hands-on physiotherapy may be helpful in that short term. There can be a role for manipulation of the spine in the short term. There can be a role for medication use in that time frame as well. And in certain situations where there is evidence as the doctor talks to the person or examines them, there can be evidence that there may be some harmful underlying conditions. For example, if someone has a nerve-associated pain or nerve-related pain, sciatica running down their leg, there may be a case to get some investigations done in the first instance. This is the red flag issue, as we call it in the medical terminology. So that's all about treating the acute episode, but mostly if people keep active and stay mentally positive, most acute back pain will settle over time. And that's quite different from the chronic pain situation, where really we're looking at helping people to explore the multiple possible contributors to that situation. What we spend our time often thinking about from the biomedical perspective is actually helping people slowly and carefully to come down and off medication, because the evidence scientifically would say that generally, although medication is good short term, it can easily become counterproductive in the longer term. And then beyond that, there is a lot of scientific evidence now to say that from a mind-body perspective, addressing the psychological aspects can improve our psychological status, but can improve our physical status as well and reduce pain. We do spend time talking about the connection, because it's easy with people to become socially isolated because of pain. So helping people to engage socially and connect with the outside world can be helpful.
The two most important things I would say to a person who's reached a point where they need to find out, where they're worried about their persistent low back pain, is number one, stop looking for that silver bullet, that diagnosis that's going to fix things, because it will be complex and it won't just be one thing. And number two, make sure that you stay in charge of the decisions that you make, because that's going to contribute to your pain if you're not in charge. And so you need to find a person who is a specialist in pain and stay in charge.
Pacing is a good way of approaching pain management because it allows you to get back into activities without causing flare-ups. And it's not just physical activities, it could be pacing to get back into social activities, pacing to do household tasks. It's looking at setting, I guess, a time frame or a level of activity where you don't cause a flare-up, where you're comfortable. But it's not also about staying at that point. It's also about gradually increasing those limits so that you do gain more function and gain more ability to perform that activity.
Well, what we are finding more and more is the association, how strong the association is between the stress response and our health and chronic disease and chronic pain. So we know that, I guess you could say now that we no longer divide the brain and the body, that instead the brain is all over your body. And so every misery that we're prone to, in emotional misery or thinking miseries, is reflected in our body. And we have to start looking at it that way now, because that's what the modern approach to medicine is showing us, that this is what we need to do.
There's interesting neuroscience talking about isolation. If someone is feeling socially isolated, that can add to their sense of danger. What we're trying to do in treating chronic pain is to help people to feel safe. That quietens the nervous system. So if people engage in groups and sort out difficult situations with their family, that adds to a feeling of safety, which will quieten the nervous system. So good evidence around that being part of the process. And that again is why often we're offering treatment in group settings to help with that social reintegration. And then to go to physical activity, definitely good evidence around that. And I would say we've known for a long time that physical activity is good for our muscle strength, balance, and so forth. On top of that, though, the new evidence is showing that physical activity is good for the nervous system. So again, mindful movement, controlled movement brings a message of safety to the brain, and that helps to quieten the nervous system and reduce pain over time. So not only is physical activity good for keeping us fit, getting the weight off, making us strong, but definitely helpful for quietening the nervous system and pain.
I know a lot of people say that, they're trying to ignore their pain, they're trying to fight against the pain, but I guess it's looking at a struggle, and if pain's always in your face and you're trying to get rid of it, you're missing all these opportunities which are going by. You might not be able to get rid of that pain, but if you just place it on your lap, but then you can start seeing the opportunities which are happening.
Well, it's very hard, and it's in approaching it and talking about it and managing it is only the beginning. So I guess it's just about acknowledging that. I think that we find in our pain programs that just the sheer act of going to the program and sitting with other people who have the same problem has an enormous therapeutic value for people. In fact, sometimes we talk about that's maybe where the main value is in social support.
If there was one bit of advice I was to give somebody with back pain that had become troubling, is make it your own back pain insofar as harness as many self-management strategies as you can and be confident that you can take control of it. Over-reliance on people doing things to you, manipulating endlessly, massaging endlessly, acupuncture endlessly, without having a balance of other strategies to help control your pain, I think is folly, and it creates a dependency on various practitioners.
My advice to people who are worried about their back pain is that I would probably worry if I didn't have back pain. Because remember, 80% of society are going to have back pain, so you're one of the normal, everyday people. To go through life without back pain would be an amazing, almost freakish feat. So don't worry about it. It is not pleasant, and it's something that you're going to have to deal with, but it doesn't stop you doing anything you want to do as far as your work and recreational activity.